Wonderful. We're now going to be moving to our first panel discussion, focused on the need for reform. Our first moderator will be Dr. Ellie McCants-Katz. She is the Assistant Secretary and Administrator at the Substance Abuse and Mental Health Services Administration at the U.S. Department of Health and Human Services. Dr. McCants-Katz will introduce our panelists.
Well, good afternoon. It's my pleasure to moderate the first panel called The Need for Reform. And I'd like first to introduce to you our panel members today. And I'll start with DJ Jaffe. DJ is a former advertising executive and has a seriously mentally ill relative. He has served on the boards of numerous nonprofits, and he is the executive director of Mental Illness Policy Org. He's written op-eds for the Washington Post, New York Times, Wall Street Journal, and is the author of Insane Consequences: How the Mental Health Industry Fails the Mentally Ill, which has created a lot of conversation, important conversation, on addressing issues related to serious mental illness in this country. Let me also introduce John Snook. John is the executive director for the Treatment Advocacy Center. In addition to being a family member of a loved one with a mental illness, John is an attorney with nearly 20 years of policy and advocacy experience at both the federal and state levels. John also serves as a member of our Interdepartmental Serious Mental Illness Coordinating Committee, also called the ISMIC. And our panelist, Dr. Matthew Stanford. Dr. Stanford is the Chief Executive Officer of the Hope and Healing Center and Institute in Houston, Texas, and is an adjunct professor of psychiatry at Baylor College of Medicine and the Houston Methodist Hospital Institute for Academic Medicine. A fellow of the Association for Psychological Science, his research on the interplay between mental and health and faith has been featured in such national publications as the New York Times, USA Today, and Christianity Today. He is the author of several books, including the recently released Grace for the Children: Finding Hope in the Midst of Child and Adolescent Mental Illness. What we'll do with this panel is first we're going to hear from each of our panelists. They'll speak for several minutes, and then we will have some questions and answers, and then I'll wrap up the session for you. So I'd like to start with comments from you, DJ.
First thing I have to do is to thank Dr. McCants-Katz for the stellar work she's doing as Assistant Secretary in focusing the government on the seriously ill, and my idol, Dr. Fuller Torrey, who's really the godfather of all these changes that we're seeing. Now, let me apologize ahead of time. What I'm going to say is different from what you're used to hearing, and that's because I am not a mental health advocate. I am an advocate for the seriously mentally ill. And to put that in perspective, 100% of the population can have their mental wellness improved. 18% have something in the DSM, but there are 4% who are really seriously mentally ill, meaning they have a functional impairment so severe that they have trouble coping with daily life activities. We're in the White House. John Hinckley shot President Reagan because he knew, not thought, he knew that was the best way to get a date with Jodie Foster. That is serious mental illness, and we are failing people with it. Now, my book argues, and by the way, if anyone here wants a copy, give me your card and I'll send it to you. You're all influential people, so I'd be glad for you to have one. But my book argues that the reason that homelessness, violence, arrest, incarceration among the seriously mentally ill is going up is because the mental health system itself no longer focuses on the most seriously mentally ill. I argue that we're spending way too much money on mental health and not enough money on serious mental illness. Think about it. We went from a hospital-based system, which by definition served the seriously ill, to a community-based system that largely rejects people who are so seriously ill they would otherwise need hospitals. Instead of serving the seriously mentally ill, the mental health system now wraps every important social ill, whether it's bad grades, unemployment, divorce, angst about gender identity, bad grades, bullying, in a mental health narrative, and diverts mental health funds to serving those issues, not serving people with serious mental illness. Nothing's left for them. And Dr. Drew described some of the consequences of that failure. As a result of that, 40% of the seriously mentally ill, about 4 million people, receive zero treatment. And that is what largely explains why there are 140,000 seriously mentally ill homeless, 400,000 mentally ill incarcerated, 750,000 mentally ill on probation and parole, why there are 10 times as many people incarcerated for mental illness as there are hospitalized for mental illness. The result of all this is that police and sheriffs are being overwhelmed running a shadow mental health system for those the real mental health system no longer treats. Now, the reason this hasn't happened, that we're not focused on it, is that politicians and mental health officials are being misled by mental health advocates. They're believing mental health advocates rather than their own eyes. For instance, mental health advocates regularly tell politicians the mentally ill are no more violent than others. It's our #1 claim. But the untreated, seriously mentally ill are more violent than others. And the mental health advocates know this. If they're no more violent than others, then why do psych nurses wear panic buttons and those in liver units don't? If they're no more violent than others, why are psych units locked and heart units aren't? If they're no more violent than others, why do we want money to train police to deal with the mentally ill rather than people with illnesses like leukemia? Mental health advocates tell politicians if we intervene early, we can prevent mental illness. We can't prevent schizophrenia and bipolar disorder, the two most serious mental illnesses. There will be a Nobel Prize to whoever figures that out. Now, we can prevent progression, and they're funding a lot of first episode psychosis programs, and those intervene in people who've already developed some form of psychosis. They claim stigma is the biggest barrier to care. Nonsense. Any mom or social workers know that stigma is not the biggest barrier to care. The biggest barriers to care is there's no doctors, there's no social workers, there's no programs, there's no clubhouses, there's no housing, the cost is too high, the person has anosognosia. Let me say it very clearly. The homeless psychotic guy who's eating out of a dumpster is not avoiding care because he's afraid what his fellow dumpster diver friends will think of him. He's avoiding care because there's no services for those people. And I know it's politically incorrect to say so, but it's the truth. Now, I go to both criminal justice and mental health conferences. And what I say is that if you go to a criminal justice conference, they will tell you that to reduce the things we're here today to reduce, that we have to have enough hospitals. And the hospitals have to keep the person long enough to stabilize them. And the police will say they need a civil commitment standard so they can get them into the hospital. And they'll say that when the hospital discharges somebody, they have to give them housing or assisted outpatient treatment. That is the way to solve the problem. So what I suggest to anyone who's involved in this field is meet with your police, meet with your sheriff without mental health people in the room so they don't have to be politically correct and so they can talk about the real issues that need solving. And in order to solve the issues of civil commitment and assisted outpatient treatment, we have to stand up to the ACLU, to Bazelon, to disability rights, to protection and advocacy, to many mental health groups who now believe that being psychotic and delusional is a right to be protected rather than an illness to be treated. Now, hopefully, John is going to talk. Hopefully, John's going to talk about some of the specific things that'll get you to the system I'm envisioning, about changing commitment standards, the need for more hospitals and the role of Medicaid in that, and about assisted outpatient treatment. And importantly, how HIPAA handcuffs prevent families like mine from delivering care to our own seriously mentally ill relatives. And again, all these are described in my book. If you want a copy, give me your card. I'll send one to you. And most importantly, I thank you all for being here and working on this problem.
Thank you, DJ. And John, can you make a few comments?
Sure. There we go. So I was given the task of following Dr. Drew and DJ. So